This is Ellen Clark, CEO and founder of Control Corrective Skincare Systems. This is a demonstration of our Smoothing A.H.A. Body Peel, a go-to treatment for those looking to rejuvenate or smooth out their body skin. Leaves these areas looking younger, firmer, smoother, and more even. A deep exfoliating glycolic acid peel dissolves the top layer of skin imperfections, followed by a serum that rehydrates and softens the skin. The digestive enzyme mask finishes off with extra smoothing and hydration. Ideal for those who already have a youthful looking face and want the rest of their body to match up. The A.H.A. Body Smoothing Peel is excellent for individuals with rough texture on their body, be it the back, the chest, the arms. So many women, their face looks good, but their neck and their chest and their back is real crepey, and the dry skin cells are all stuck together. So with this treatment, you're going to really smooth the skin out, hydrate it, and make quite a difference. With this treatment, you can use the cucumber bead cleanser and the salicylic wash. You can do a first cleanse with the salicylic wash and then the cucumber bead, or you can mix the two together. I'm going to mix the two together for our demonstration. I do a pump of salicylic wash and a pump of cucumber bead cleanser. The salicylic wash is keratolytic, exfoliating, and a nice cleanse for oilier areas. The cucumber bead cleanser, why I like it so much, is that it has the little polyethylene beads in it, and particularly for the body's tougher and the dead skin cells are usually thicker, particularly where somebody has real dry skin and they really need a good cleanse. So many people break out on their back and they're really ashamed of it and embarrassed, and they don't tell anybody they do. So make sure on your intake form, when you're talking to your client, you ask them, do you break out anywhere else on your body, or do you have any other areas that are really rough and dry? This treatment can be done as an express 30-minute treatment, or you can make it a full hour depending on your menu. The cucumber bead cleanser everybody loves because it smells amazing. It can be used on the face and the body. Teenagers love it. It's non-medicated, whereas the salicylic wash contains 2% salicylic acid. And you may not know this, but salicylic acid at 2% is what is in most dandruff shampoos. It helps to slowly digest those stuck dead skin cells, for a lack of better words. You're going to want to use a nice warm towel. Have some towels available because in this treatment you may use several. So we're going to remove our cleanser, make sure she's well exfoliated. If I did want to steam, I could do so in the beginning cleansing phase. That's always nice. After cleansing, you're going to follow with the balancing tonic. I like these big cotton rounds for the back. Also, if you're doing the back and large body part areas, like I used to do a lady, her stretch marks on her legs, and she would come in every week for almost 6 months, and we really reduced the depth of her raised stretch marks. And I actually went and bought more like a paintbrush so I could really work on a large area. So you may want to think about that if you are going to be doing a lot of back treatments or large body areas. We want to make sure that the back is dry, much like the face when you do a glycolic peel. You want to make sure that the area is dry. Whether you tissue off or you use the fan, you want to apply your glycolic to dry skin. Now her back is completely dry, and we're going to apply the Glycolic Peel 33%. This is a thin gel, so it's real easy to apply. You're just going to paint it on. Essentially, apply the Glycolic Peel on rather quickly to the area you want to treat and work on. Whether it's just the aging skin or breakouts or rough skin, you're just going to paint it on. Very easy. Set your timer for anywhere from 3 to 5 minutes. The body is most of the time, particularly on the back on the arms. You can leave the glycolic on longer. This is our 33% Glycolic Peel, which we use on the face, and on the face we leave it on 2 minutes. But on the body, it needs a little bit longer. So we're going to set the timer for 3 minutes, and after 3 minutes, what you sometimes see is a little pinkness and spots. Other people, you can leave it on 5 minutes and they do just great. So we're going to leave this on, and then we're going to neutralize it like we would on the face. What you want to make sure of is that if a client really does have a problem like back acne, or they have a condition like ichthyosis, which is that alligator legs, or real rough areas, keratosis pilaris on the back of the arms, that you have them come in with some frequency, perhaps once a week for a series of 6. Because this is so easy to do and it's a short-term time in the business, they're here maybe 15, 20 minutes, you could do a lot of body treatments. The key is on your intake form to just ask them what else is going on their body. Massage therapists see dark spots on the body all the time, but sometimes it doesn't equate to the client telling her esthetician. Once this has been on the body 3 to 5 minutes, we're going to remove it with a cool towel and then remove it again like you would on the face. The client might feel a little tingle, and you may have noticed I didn't use a fan. Generally speaking, on the back, you're not going to need a fan. If the client says she'd like it, and it's nice to have, but most of the time, clients do not need it. Because the pH of our Glycolic Peel is a 3.0, it's perfect for doing these treatments because we're not going to get hot spots or over-irritated areas if you follow the protocol. So see how easy that is? It's already digested, it's smoothed the skin. She's got a little pink right there, maybe that's an area she itches, but that'll go away. Make sure you neutralize it, make sure the client feels no more tingling, no itching, just like the face, and we're going to follow with balancing tonic. Make sure all that glycolic's removed. Because you can't see glycolic acid, you really want to just double check with the client that they don't have like that none dripped or that they don't feel an itch like under the arm area. Alrighty. So simply done, the Glycolic Peel's completed, and now we're going to go into massaging the back. We use the Skin Nourishing Balm. It's an aromatherapy balm that has natural butters in it and essential oils, and you're going to proceed with a normal back massage. Usually the back massage will last about 10 minutes. You can do the arms, the hands, the back. I once heard a trainer say that massage gives people the buys, which means if you just do a quick back treatment, glycolic, light moisturizer, and they're out of there, you know, that's okay. I guess that's what you might expect in a medical office. But if you take the time to really massage the back and relax the client, they'll rebook not only for just the smoothing, but they'll rebook because of the massage. So take the time to do a good back massage, work that aromatherapy balm in. The Skin Nourishing Balm really, really softens the skin, and so many people that get this treatment have extremely, extremely dry skin. So this is just going to improve their skin quality and hydration. Once you've finished your massage, you're going to actually leave whatever excess of the Skin Nourishing Balm is on, and you're going to follow with the mask. We're using the Sensitive Skin Enzyme Mask. Because this lightens and brightens and calms, and it has those natural papaya enzymes in it, I want to use this mask. It's a creamy clay, it's easy to apply, it comes off easily, feels really good on the skin. If you do have gloves on, you could even massage it in a little bit after you apply it. Just Apply a real thin coat. For the back, I use about a teaspoon, a rounded teaspoon, maybe a little more depending on the size of the back. If someone has acne, like a lot of acne, this mask is great, but you could also dab the blemishes with the sulfur calming mask first, let it dry a little bit, and then apply this over. We're going to leave this mask on about 10 minutes. Again, you can do more massage, you can just let the client rest, and then we're going to remove it with a wonderful warm towel. We've waited the 10 minutes, our client is thoroughly relaxed, and now we're going to remove the mask. Comes off easily. Once the mask is removed, I'm going to apply the hydrant stabilizer. This is a very hydrating gel. It's an aloe-based gel with botanicals that soothe. I want to hydrate her skin. Feels really cooling. I don't like to put too much heavy stuff on the back because she doesn't really need it. If she is going to be in the sun, however, I will put the oil-free sunscreen SPF 30. Once this hydrant stabilizer absorbs into the skin, you just put it right over. And I can put a little on right now. Her skin will feel really super hydrated. It's much smoother than it did when she first came in. And if she continues and comes in weekly and does a series of treatments, it will really smooth the texture of her skin. And what's great about that is she can do that for 4 to 6 weeks in a row. We can send her home with our intensive body smoothing lotion, which contains 20% glycolic acid for home use. And she won't even need to get the treatments quite as often because that product alone will continue to help smooth her skin out. And that completes this treatment.